friends, I am Dr.Anurag Sexena, Head of Department of Neurosurgery at Manipal Hospitals, Dwarka, New Delhi. And in this video, we are going to talk to you about the period after your brain tumor surgery. So what to expect, what not to expect, and what to take care about after the brain tumor surgery. So patients who have undergone a surgery after the brain tumor, the post-operative period can be divided into three broad categories. One is immediate post-op, then during the follow-up, and after a few days or weeks after the surgery. So immediately after you've undergone surgery, once you are out of the ICU and in your ward, normally a dressing is done to make sure your wound is okay and he's healing well. You are given certain courses of antibiotics and other intravenous drugs, and gradually you are with the physiotherapy and gentle mobilization is started. Now as you recover, the medicines are converted into oral medications and your diet becomes normal. You are discharged. And then we see you on a regular basis just to make sure that your wound is healing well and you are taking medicines and you are not developing any problems regarding related to surgery. After your stitches are removed, depending on the histopathology or the biopsy report, which in subsequent follow-up we come to know what kind of tumor it is and what is the grade of the tumor. Now brain tumors do not need staging. We do not do staging for the brain tumors, but brain tumors have grades. So grade 1 brain tumor is a low grade tumor, and the highest grade which can go is a grade 4 tumor. So whenever you have a grade 4 tumor or grade 3 tumor or sometimes a grade 2 tumor, then you can be referred to a radiotherapist, which means you require a radiotherapy. And in certain cases, depending on further genetical study of the tumor material, you can be referred for chemotherapy. Now radiotherapy can be given in cycles, it's roughly around 30 cycles or 6 weeks. So the whole dose of radiation is divided into small doses to reduce the side effect of the radiotherapy. Now when you are on radiotherapy, you might develop headaches or some nausea or some other untoward side effects which can be treated with medicines, and that's why you are kept under regular follow-up. Now once your cycles have gone through, you have gone through the complete treatment of the brain tumor, then comes the period of a regular follow-up. This is to pick any early recurrence of the tumor. Benign tumors, if completely resected, the chances of recurrence are very, very low, and sometimes they do not come back at all. In that case, we are declared cured of that particular tumor. In malignant tumors, chances of recurrence are much more, but it also depends on the type of the tumor which is there and how much tumor we can remove surgically and how good the response of radiotherapy and chemotherapy is on the tumor. So the way to follow up is with serial scans on regular intervals to pick the tumor recurrence early and start the treatment again so that it doesn't increase in size. But if you develop during this follow-up any of the symptoms which you previously had, like increased headache, nausea, vomiting, you have a recurrent episode of a seizure or any other symptom which you think is remotely related to your brain tumor, the first thing you should do is immediately consult your neurosurgeon. I hope this video was helpful. Thank you.